Bruce Springsteen postpones tour to recover from peptic ulcer disease. What to know about the condition? Springsteen, 74, is recovering from peptic ulcer disease, a digestive condition. Here's what it is. On the advice of his doctor, legendary singer, songwriter Bruce Springsteen, who recently turned 74, postponed his worldwide tour to continue recovering from a digestive condition that many people born in the USA can relate to, peptic ulcer disease. Thanks to all my friends and fans for your good wishes, encouragement and support, he posted on Instagram on September 27. I'm on the mend and can't wait to see you all next year. A statement shared on his Instagram reads, Bruce Springsteen has continued to recover steadily from peptic ulcer disease over the past few weeks and will continue treatment through the rest of the year on doctor's advice. Starting this February, the tour was his first since 2017 with the E Street Band. It originally began in the United States, then continued through Britain and Europe before the band returned to the US in August. Springsteen previously cancelled 8 shows earlier this month in hopes of resuming his tour in Canada starting in November. But he later posted on social media that, out of an abundance of caution, all 2023 shows are cancelled. What is peptic ulcer disease? After we place food into our mouths, our teeth combined with enzymes in our mouth help break down the food before it winds down the esophagus into our stomach. This triggers the stomach to produce acid as well as special enzymes to break down the food into even smaller particles, so that nutrients can be absorbed later in the small intestine. The stomach doesn't digest itself because it has a special protective mucus lining. As long as the special factors that line the stomach and the digestive acidic juices meant to break up food are in balance with each other, the stomach acid doesn't damage its own protective coating. Peptic ulcer disease is essentially the wearing away of the lining of the stomach and/or the small intestine, Dr. Arnab Ray, section head of general gastroenterology at Ochsner Health in New Orleans, Louisiana, told SSN 24 in an email. The disease is most commonly associated with a bacterial infection called Helicobacter pylori, H. pylori, which causes inflammation in the stomach. Many people have this bacteria in their body without ever developing an ulcer, according to Penn Medicine. NSAIDs may cause ulcers. You can also develop peptic ulcer disease from the use of NSAIDs, nonsteroidal anti-inflammatory drugs, more commonly known as ibuprofen, Ray added. NSAIDs are a class of medications available by prescription and over-the-counter to treat pain, fever, or inflammatory conditions. Some examples include naproxen, Aleve, ibuprofen, Motrin, and aspirin, Bayer, according to Cleveland Clinic.